Hi everyone, my name is Mason Trinh and I'm from Lighthouse Social Enterprise in Vietnam. Today, I would like to raise one discrepancy. In the past 5 to 7 years, there has been a significant advancement in terms of mental health research and interventions for gay and bisexual men in Western nations, as well as high-income Asian nations. However, there's little that is known about the related research and interventions for gay and bisexual men in developing Asian countries. Yet, what we do know is that around 80% of the people on a global scale who live with mental illnesses reside in low to middle income countries. Also, what we know is that gay and bisexual men in general display greater psychological distress as well as heavy drinking compared to heterosexual counterparts. If we put such evidence together, we get that gay and bisexual men in developing Asian nations face a greater disparity of developing mental health problems. In response to such problems, overall, there are still insufficient mental health services that actually meet the needs of these men. In a lot of developing Asian nations, the available mental health services are mostly psychiatric, which means they would treat patients in inpatient facilities, and they only do outpatient drug treatments. And also things like, for health programs, they only provide the majority of the other funding to sexual health or HIV prevention treatment programs. Also, for different CBOs, the majority of their counseling services focus on HIV counseling with very little information on mental health. And their peer counselors only operate on very little information and training. All of that point to many barriers that these gay and bisexual men in developing Asian nations face in terms of meeting their own mental health needs. We at Lighthouse Social Enterprise were extremely curious of how these men maneuver through such barriers and get their mental health needs met. We found that the majority of the people in our sample reported much anxiety, depression, stress, self-harm, and suicide in the past. Also, we found that these concerns were correlated with low social support, moderate to high internalized stigma, and more risky sexual behaviors in general. When asked about how they care for their own mental health needs, they reported non-traditional methods such as self-healing, seeking emotional support from family or friends, as well as attending some psychoeducation workshops. Also, when asked about whether they have taken any, more professional mental health care, they reported going to, community-based organizations or LGBT/MSM specific private clinics for such concerns. We also asked them about the barriers, between them and professional mental health service utilization, and what they reported were the financial issues that come with the deals. Like they didn't know much information about the available services around them. They had much concern with the confidentiality policies of these services. Also, they felt like the healthcare workers would have a lot of stigma against them as MSM. So based on these very findings, we have offered 4 evidence-based recommendations that fit on different ecological levels that we can all tackle in our future attempts. The first one is to promote the mental health literacy and self-efficacy at the personal level. In order to effectively promote mental health literacy, we should definitely demystify mental illnesses on a variety of interactive and creative social media campaigns on platforms such as TikTok, because TikTok has been a prevailing platform in developing Asian nations. Secondly, we can also increase healthy coping through a variety of online psychoeducation workshops, as well as accessible educational materials as well. Secondly, another recommendation is to increase the quality of the emotional support that these MSM receive from their interpersonal relationships. Since they reported, going to their family or friends for emotional support, we should definitely, educate their family and friends on how to actually conduct psychological first aid in case, these men come in time of crisis, or, how to actually provide quality emotional support in case of needs. Secondly, we should definitely promote more and more support group programs to cultivate resilience among peers of the same sexuality. The third one that we have is to create a strong network among trusted CBOs and private clinics and reliable mental health service providers. From this strategy, our MSM can benefit from, learning about the actually like the MSM friendly and supportive mental health services that they can count on, through the information provided by the CBOs and the private clinics through, like a national map of MSM-friendly mental health service providers. Also, these different CBOs and private clinics should develop a concrete referral protocol based on varying needs of these men as well. Thirdly, professional psychologists should team up with CBOs and private clinics to sort of like devise greater mental health services for MSM in terms of, like crisis hotlines or free counseling sessions on a weekly basis. Lastly, we have to remove the barriers of mental health care at the structural level. Since, our MSM claim that there are a variety of different, barriers in terms of service utilization, things like financial assistance, they didn't know any information about the available services. Like they felt like they were stigmatized against, from the side of the healthcare workers. They were concerned about the confidentiality. All of our, future policies or programs should tackle all those things. Lastly, I would like to emphasize the fact that this topic, which is the mental health disparities among gay and bisexual men in developing Asian nations, is extremely underrepresented in many conversations of global health for gay and bisexual men. People in developing Asian nations are often put on a side, or often people would assume that like their central needs are just sexual health or HIV prevention or treatment. But since we're all human beings, all of our health concerns should be treated equally. So I do stress the fact that we should provide equitable mental health care for developing Asian nations, for these men in such nations. So if you do have any questions for me, please feel free to email me with the email that I provided on the screen. Thank you, and please enjoy the summit.